Bonjour everyone, I am Anne-Lise Cailliez and welcome to Parlez-vous CEO, where we ditch the corporate talk and get real about entrepreneurship. Each week, I chat with founders and CEOs who build businesses their way, through the failures, pivots, and breakthroughs. And they bring the fire. Plus, I'll drop some golden nuggets of wisdom from my own entrepreneurial journey. This is your space to grow, learn, and evolve with a true growth mindset. Remember, success isn't about perfection, it's about persistence. Now let's kick things off and get this party started. Welcome to another episode of Parlez-vous CEO. My name is Anne-Lise Cailliez and I am your host, and I am here today with Tejal Kaur. Tejal, in your own words, would you introduce yourself for the people who are just discovering you and want to know a bit more about your story?
Sure. So my name is Tejal Kaur. I am a psychiatrist and I run a practice called Gray Matters Medical Practice in New York City. Oh my gosh, Gray Matters has been kind of like the culmination of all of these different parts of myself and the parts of what I've seen in the healthcare system kind of put together into a community. So we're a group of clinicians from different specialties with different disciplines and niches, and we work together to serve various populations of people. It's really important to us that when people come to us, they feel that they can identify with the person they're working with, that they feel comfortable, that they can be open, that they don't have to mask. So we just try to be a place that's very inclusive, and then also within our treatment that our work is really focused within the relationship, because even if you have if you know exactly the evidence base and which treatments are the right treatments for this and what's the newest evidence for this, I feel like it doesn't really hit the person. It doesn't translate unless you are working together in this relationship where the results kind of come through that. So And so
Tejal, you run a psychiatry and a therapy practice in New York City. And lately the work has been pulling you outside the walls of the office, into companies, schools, into conversations with other clinicians. And I wanted to find out why. So Tejal, what does it feel like to sit with a case you're not sure about and have nobody to call?
It's so lonely to feel like you're sitting with, you're working with someone and they're struggling with something, and you maybe don't feel like you know exactly how to help them, and you don't know where to go or who to talk to. When you're in private practice, it can be very isolating. And I think that's also why when I initially started my practice, it was just me. And I didn't like that feeling. I felt like, even just personally for myself, that I wanted to practice within a community. And so when you don't have that community, you're kind of like, am I doing the right thing? Am I not? And it doesn't feel great. So I think when you have a community of clinicians, or even a few trusted clinicians that you can go to, and discuss some of the the cases that you're working with, it just leaves you feeling a lot more confident, because no one person can know everything. And I don't think that we should trust is the right word, but we shouldn't rely solely on ourselves, because we will miss things. It's important to consider other possibilities than the ones that your own brain will come up with, right? And I think it leads to better care.
Tejal, what did you feel supervision in training give you that private practice doesn't?
When you're in training, it's very different, because you're not 100, even if you feel very responsible for the people you're working with and treating, there's always this other layer, right? There's someone else overseeing. There's someone you can go to also when there's any questions or issues. And there's a level of comfort in that, just a sense of security that, I'm protected. I'm not going to mess up, because I have these supports. And then you finish your training, and then it's like you're suddenly supposed to be this expert. But I know even experts are not experts, right, in everything. Yeah, just having, I think even when you're in private practice, you're operating independently, creating areas, people where you can go to for supervision is so important for both how you feel about yourself and your work, and then also for your patients. because they get better outcomes.
And when you started Gray Matters, were you building the kind of place you wish existed when you were early in your career?
I think throughout my career, I've always seen things and then thought, I like this, I don't like this. And the things that I don't like, I'm going to figure out how I can do them differently. And so Gray Matters is also kind of this culmination of all of the things that I've seen that I felt like didn't work. And I just wanted to be a place where we try to do them differently. And it continues to grow because I think that to best serve people, that we have to constantly be adapting, and the systems around us are changing, and we have to see like what is working, what's not, and shift. So it's an ongoing process.
What would you want a therapist to know before they refer a patient to a psychiatrist?
When I wish that therapists knew that they could refer a patient to a psychiatrist before they thought that the patient truly needed to be on medication. Because the earlier that we as psychiatrists can be a part of something, there's less of a need for more intensive medications. There's a lot more conservative approaches. And often people come to us when they're really just so ill, and more a little bit, like people are coming earlier, and that's just so helpful because we can help them even more. And so let's say like medicine might be an option for someone down the line. I think it's much better for that person to be aware of that and to kind of understand it and know their options early in the process so that they can make more informed decisions. When you're in a crisis, it's more difficult to make the decision maybe you wished you had made, whatever that decision is. I think it's always better when you're kind of like thinking ahead.
What made you want to create a group for clinicians specifically, not another lecture, not another conference?
I think that in our practice here at Gray Matters, like we've just been really happy with each other as clinicians. Like we really enjoyed the sense of community. We grow because of each other. We teach each other. We just have been wanting to extend that outside of ourselves. And so we began doing that like many years ago through having students that, do their clinical rotations through our practice, and they get credit from Columbia and NYU, and that has been very rewarding. But it's also, we can only reach so many people, and we want to provide this sense of community and support to as many people as we can, just because I think like we've benefited so much from it that we want to share it with others.
You treat a lot of working adults. What are you hearing from them about their jobs that you don't think their employers know?
When we are working with adults, we notice that they often are struggling in their jobs for so much longer than their employer manager would even have a sense of. Like when it starts to come up at work, it's because like the cracks are beginning to be visible, even though that person has spent so much time and effort kind of concealing the cracks, right? So there's a lot of interventions or ways that we could help people in their jobs as well as companies with their employees if we could be involved earlier in that process.
You've already done this kind of corporate work. What happened the first time you worked into a company, and what surprised you?
When we began working with different companies in these corporate environments, I was really struck by how much people wanted to connect with each other, even if they didn't say that explicitly. Like they really wanted a sense of belonging. They wanted a sense of being seen. So that comes out most, I think, or it's most visible in populations where someone may have an identity, like be non-binary or neurodivergent, or something where they don't feel seen, by their employer. But I think in like many more subtle ways, people are also like wanting to be seen. And that's part of this connection. They don't want to really just go to work and come home. You don't have to like share a lot or be super personal or overshare or anything, to have connection, but it's really about like being seen too. And I think just a lot of people just don't feel seen.
What's the difference between a wellness seminar and what you actually want to offer a company?
So when mental health companies work with corporations, they often, one of the things that they provide are like wellness seminars. So that could be something about like meditation or yoga or things that are that helpful, but I think that they are only part of kind of the plan that a company would need to, if they actually really wanted to significantly improve well-being, because they're really getting at the downstream effects. My nervous system is dysregulated and I have all this cortisol and so I'm going to meditate and that's going to help me briefly, right? But it doesn't resolve like what's going on. It doesn't look at like what are the causes of this dysfunction and why do I feel this way in the first place? Like where are the parts that are coming from the work environment? Where are the parts that are individual? And how do we actually address that? So when we go into a company, we may provide like wellness programming, but the way that we do it is that it is ideally it's part of a larger program where we are using these community events or services that we're putting on for the company as a wellness measure, but then also as a way for us to understand the company better so that in the subsequent phase, we understand their culture, we understand their employees and staff so that we can, so that we curate the programming for their needs specifically. And then we like to tie that in with individual services as well. So that could be providing individual services, therapy or psychiatry to their employees. It could be providing executive coaching to their managers. It could be workshops that are working on various skills or on connection. But it's really, we want to take like a big picture view and really understand the company that we're working with and then think about what could be helpful for that company and like what's the order that we should do it. Like it's a very thoughtful and individualized process.
When you think about neurodivergent employees specifically, what do managers get wrong that you see the consequences of in your office?
I think when many managers are working with individuals with neurodivergence, they're not aware that they're working with someone with neurodivergence because it's so much masking. And many people don't feel comfortable kind of talking about, how they identify or how they process information or what their preferences are. But that's so important to doing quality work. So I think it's just difficult for managers. Many managers really don't have the knowledge to understand and name like these different ways of processing information that their staff may have. And then they make many assumptions about their employees that may not be accurate, right? So they're really like, there's this mismatch.
And so what would you say are the consequences of this mismatch?
We work with a lot of neurodivergent individuals who work in big companies, who are very skilled at their work, and they get to a point where they just can't go into work anymore and they require like medical leaves for a period of time. Sometimes they're not able to go back to work. And in many cases, like if we could work more closely, with that company or that company had other resources to be able to understand their staff's needs more, I think that some of these medical leaves could be avoided. It just gets to the point where it's just too difficult for people.
If an HR director called you tomorrow and said, I don't know what to do with my team, what would you want to say to them?
I would ask, if an HR director came to me and said, I don't know how to work with my team or I don't know what to do, I would ask them, what are you not saying? What you're asking, what should I do with my team? But I feel like you already have thoughts and feelings and assumptions about your team. Like, tell me more. And don't feel that you have to, make it sound pretty or that I'm going to interpret it a certain way. It's really like we all kind of, when we face difficulties, make different assumptions about a situation. And some of those are right and some of them aren't. Let's talk about them all so we could better understand, because there isn't going to be like one piece of advice that's going to fit for you and everyone else, right? Like we have to like better understand, like, what are you working with? And by understanding that better, then we can figure out what might be some of the ways forward.
A big part of your practice is kids and adolescents.
Mm-hmm.
What's the relationship between what's happening at school and what you see in the clinic?
We work with a lot of kids and adolescents, and what we see is that, when kids are struggling, they mask as much as they can at school. They compensate as much as they can. And so that when you're starting to see the struggle at school, when the cracks are visible, it's because it has gotten that bad. If you think about little kids, for instance, I feel like you'll rarely see a little kid that says, I'm not good at this. Kids want to be good at the things they do. They want to be good at school, right? And when you hear a kid say I'm not good at this, I'm not good at math, school's not for me, it's that's been beaten into them over time, because I think naturally they want to excel. The school is like the workplace of kids, right? Adults go to work, but school is kids' work. And it's demanding. It's there's academic demands, there's social demands, and it's just really hard. And they try to keep up as much as they can. But if there's something that is interfering with their ability to excel at school, and it eventually catches up to them, they've already put so much effort in, right? And so that's where we really need to work with the school and the parents and, whoever else is involved in the kid's life. Because if a child is having mental health difficulties, they will also present in school, right? And then the demands of school may worsen those mental health difficulties. And then the worsened mental health difficulties make school even harder. And it's a feedback loop. So it's such an important place for us as psychiatrists to know about, how is our kid doing in school? That's one of the most important parts of their life. And a place where we can intervene early, when we see certain needs. So when I work with families and working with a kid, I might see something where I feel in a few years, this may show up in a difficult way. What could we be doing preventatively at this point that gives this kid more reserve so that we maybe don't get to that point? And I think that's what parents are really looking for sometimes, but they maybe don't know that they're looking for that, because parents want their kids to succeed and feel good about themselves and do well in the world and thrive, right? But parents don't have the experience that we may have in seeing kids developmentally over time and what factors may lead to improved outcomes or worse outcomes. And so I feel that's where I can help families most, where, without saying, oh, this bad thing's going to happen. I don't say that, but, these are areas where I feel it would help if we kind of fortify those areas, and then we can use these strengths that your child has, in that process. And it's just kind of continually working on that child's well-being, I guess.
What do you wish school counselors knew?
I wish that more school counselors knew that they could reach out to us and that we could partner, early. And we don't have to partner with the school if the child is at the point where they need an IEP or a 504. My team and I are happy to speak to anyone involved in the lives of the kids that we're working with, where we feel that partnership will improve something for that child. And sometimes just having conversations and sharing observations, problem solving together can make such a huge impact in the long run. And I think the schools really care about kids. I think the teachers care about kids and they want to help. And I think it's been hard when so many kids are struggling. And I think especially during and after COVID, there are just so many needs. And, maybe your child doesn't have as many needs as another child. And the school is trying to respond to all of these kids' needs. And it's hard. So I believe that they really want to help. And then maybe we could be one of those kind of intermediaries where even if your child is not the kid that's struggling the most, that we could still work with the school to provide some support, to think about are there areas where the school could intervene? If there's areas where they can't intervene, like problem solving with the parents, like what else can we do? Like how do we create this like supportive environment for your child? I think it's so helpful to work with the schools in this.
If you could be in front of a room of school administrators for 20 minutes, what would you say?
I would ask them first. Think, what are you seeing? What are your concerns? Because I think that there's a lot of knowledge in that room, and my knowledge, the knowledge that I have, will be most helpful if I can work with them. So what are they seeing? What are their thoughts and hypotheses, and what do they see working or not working? And using that as a base, then I feel like I can come in in a way that like maybe is more effective. And I would want to say to them that, let's work together. Like obviously you all care so much about your students, and these are the things that you're doing, and really validate them. I feel like they're not. Many times they're probably like so overworked, and the things that they are doing are not always seen. And I think when we're working in a community of healers, right, and like grouping them into that too, like we need to be seen ourselves too. And like, what are we bringing to the table, and how do we work together? So I think I would just want to collaborate more. And then, of course, like through my work, there are areas of experience and expertise that I have that I can include in that process. But I think each school, there are many areas where there are common struggles, but there are also unique struggles. And so when we're working with an individual or with the school, we really need to understand that environment to work best within it.
Thank you for being on the show today, Tejal. It was really a pleasure to have you again on Parlez-vous CEO.
Well, thank you.
And that wraps up today's episode. I am Anne-Lise Cailliez, and I can't wait to join you again next week. Thanks for listening to Parlez-vous CEO today. If you enjoyed the show, leave a 5-star review. It helps us keep going. And connect with us on Instagram at Parlez-vous CEO. I am Anne-Lise Cailliez, and I know some days are harder than others. On those tough days, think back to why you started. What you're doing today matters, even when you can't see the results yet. Ideas are great, but it's what you do with them that counts. Find everything we talked about today at parlezvousceo.com. See you next week, and you've got this.